Hi, everyone, and welcome to our review today on Medicare Railroad Plan. Hopefully, this video will explain what this coverage is and how it works. So let's begin. What is Railroad Retirement Medicare? When an individual retires from the United States Railroad Retirement Board, the RRB, their benefits will work together with Medicare. The RRB administers insurance and retirement benefits for all railroad workers in the country. So instead of getting retirement benefits from the United States Social Security Administration, as other workers would do, the RRB provides railroad workers and their families with retirement benefits along with unemployment and sickness benefits. Medicare will still be responsible for the individual's health care benefits. Okay, so when a person is eligible for either Social Security benefits or railroad retirement benefits, they will also qualify for Medicare due to age or due to a disability. They may be turning 65 years old, or they may be under 65 and have a disability. If they are enrolling in Medicare as a current or former railroad worker, they will need to follow specific steps to enroll in the Medicare program. All right. So enrollment in the original Medicare is handled by the RRB rather than by Social Security. So if they receive railroad retirement benefits or disability annuity benefits from the railroad at the time of eligibility for Medicare, they will be automatically enrolled in Medicare Part A and B by the RRB. After the RRB automatically enrolls the individual, they will receive a Medicare card together with a letter from the RRB explaining that they've been enrolled in the original Medicare, which would include Part A and B. Their Medicare card will be similar to the new Medicare cards that all beneficiaries receive, with the exception that Railroad Retirement Board will be printed in a red banner at the top of the card. If they have a disability and they are younger than 65, their eligibility for Medicare healthcare coverage differs from someone who is receiving Social Security benefits. Their eligibility depends on the RRB classification of their disability, which will determine if they are eligible for Medicare and when it will become effective. In the instance of a disability, the individual must contact their local RRB field office to discuss the details. However, if they have end-stage renal disease, otherwise known as ESRD, and qualify for Medicare, they must go through the Social Security Administration, even if they are employed by the railroad. The RRB is also responsible for collecting their original Medicare premiums if they receive Railroad Retirement Board benefits or annuity checks for railroad disability. Medicare Part B premium and Part A, if they do not qualify for premium-free Part A coverage, are deducted from their check each month automatically. When they visit physicians or other healthcare providers, they must send their Part B service charges to a separate contractor who will usually be selected by the RRB. It is important for them to inform their healthcare providers that they have railroad Medicare so the invoices can be paid by Medicare within a reasonable amount of time. Medicare offers coverage to railroad employees just as it does for people who have Social Security. The payroll taxes of railroad employees include railroad retirement and Medicare hospital insurance taxes. Okay, so how does it work? Signing up for Medicare is the same on Social Security or RRB. If the individual is already receiving benefits from Social Security or the railroad, they will be automatically enrolled in Medicare Part A and Part B. They do have the option to decline Part B if they want to. They also have the option of choosing to keep the original Medicare and then enrolling in a standalone Part D drug plan. In addition, they can add a Medicare supplement or a Medigap insurance plan to pick up the costs that original Medicare, meaning Part A and Part B, does not cover. They also have the option of moving to a bundled Medicare Advantage plan. So these plans are run by private insurance companies and bundled together parts A, B, and D, all into one plan with one point of contact. These plans are also called Medicare Part C. Okay, so what's the difference? So the most major difference is in Medicare for Railroad Board versus Social Security is how the Part B claims are handled. So unless you're enrolled in a Medicare Advantage plan where the private insurance company they use would handle all of their Medicare claims, they will have to deal with a different claims handling entity than those enrolled in Social Security Medicare, right? So the Railroad Medicare program uses an outside company for medical insurance claims that fall under Part B services. The company that is used is called Palmetto GBA, and they are a subsidiary of Blue Cross Blue Shield. They will need to submit claims directly to them if they are under the original Medicare through the RRB. This concludes our review of the Medicare Railroad Retirement Plan. I hope this presentation was informational. Thank you for watching and have a great day.